zero parallel. Sing it. Autism. Zero means drugs and zero parallel.
The adolescent stage of life is often associated with physical and emotional stresses, which can be even more challenging for adolescents living with HIV. Adolescents aged 10 to 19 years and young persons aged 15 to 24 years living with HIV often have to contend with the fear, stigma, and new reality of taking drugs every day associated with their diagnosis, often without adequate support from their parents or communities.
When I discovered my status, I wasn't really happy. I wasn't happy at all, to the extent I had to stop taking my pills because I was angry at myself and at my mom.
When I even discovered that I'm HIV positive, I was like, hi. So now those children or people like me that are having those diseases, they don't mingle with people or what. So I was now like, and I told my dad that I will not be schooling again, I'll stop going to school.
I literally would pack my drugs and flush it down the toilet. I literally would not take it. I didn't care, you know. The thing was too much for me. I didn't know what I was facing. Is it the stigma that I was raped in a community, my community, or the stigma that I had HIV, which I didn't even understand.
So the nurses told my mom to disclose my status to me. So a day came, she called me to her room. She disclosed my status to me. But I didn't feel that much bad, but it affected me quite all right. After that day, I didn't know what was going on with me. I was just feeling sad every day till the point that I even dropped out from school.
Adolescents and young people are among the most vulnerable, yet underserved populations in the HIV continuum of care. State and national surveys in Nigeria show a high unmet need for HIV services among this group, making them a key group to target for effective HIV programming in the journey to epidemic control.
HIV has been here for quite some time. We have children, we have adolescents, we have adults on treatment, and usually we monitor the parameters like their outcomes. How many people who are identified positive are placed on treatment, how many have different morbidities that come up, how many of them are virally suppressed, clinic appointments and all that. And we identified that the adolescent had worse outcomes. For instance, where we had, maybe where we have the treatment saturation at 77% for the adults, we're lagging behind, like with about maybe 38 for the adolescents in some locations. And we knew that this was going to be a really big issue.
APIN Public Health Initiatives received funding from the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, through the Centers for Disease Control and Prevention, CDC, to roll out Operation 000, a youth-focused peer support platform and a lifeline for adolescents and young people living with HIV in 7 Nigerian states: Benue, Plateau, Ogun, Oyo, Osun, Ondo, and Ekiti.
Operation 000, popularly known as OTZ, is a platform that empowers adolescents who live with HIV and AIDS to take ownership of their health. And when we say Operation 000, you may wonder what are the 3 zeros. So we have 0 missed appointment, 0 missed drugs, and 0 viral load. For the Operation 000, it focuses on the strengths of the adolescents, the competencies, and it helps us to harness and nurture these strengths and competencies because it uses an asset-based approach that looks at these trends and the best way to utilize it to help this adolescent become resilient, to become, a fully rounded adult who remains on treatment, has a viral load that is undetectable, because we know that definitely an adolescent is not going to remain an adolescent forever. They are going to grow into adulthood. So we want to have adults who are resilient and well-rounded through the OTZ program.
Before I joined the OTZ club meeting, I guess my viral load was about 200 plus. So when I joined the meeting, the we were told to know our viral load, because then we started sharing our viral load with each other. That was a very good motivation for me to be consistent in taking my drug. Well, the first few months of joining and taking the drug consistently, I had a viral load of less than 20. So presently, I am having a viral load that is undetectable.
Through the OTZ approach, adolescents and young people are reached with a package of care that includes youth-friendly HIV services, connectedness, positive living messages, caregiver education on supportive parenting, and strategies to improve treatment adherence and viral suppression.
And so the Operation 000 was looking at 3 broad challenges, which included linkage to treatment, high rates of interruption in treatment, because we had a lot of adolescents who probably started treatment as children, and once they became adolescents, we couldn't find them anymore, and lower viral load suppression rates compared to the adults. And the Operation 000 was saying, okay, can we have comparable rates? Looking at the adults and the adolescents, can we have similar linkage rates across board? Can we have similar suppression rates? Can we have similar continuity of treatment rates across board? So it looked at it in 3 prongs, the adolescents being the core of it, then we had the healthcare workers at the facilities, and we had the caregivers.
Wọ́n ní mo fi àsìkò yìí dúpẹ́ lọ́wọ́ àwọn APIN fún àǹfààní tí wọ́n fún wa pẹ̀lú àwọn oògùn ọ̀fẹ́ láti wo àwọn ọmọ wa sàn. Torí èmi fún ní pàtàkì ọmọ àbúrò mi tí mò ń mú wá síbí, mo ti wò wípé àìsàn yìí máa ṣekú pa, àmọ́ oògùn tí wọ́n fún wa ó so ẹ̀mí ọmọ yẹn ró títí di ìsinyìí. Ọlọ́run kó máa ràn wọ́n lọ́wọ́, ilé iṣẹ́ wọn kò ní dàrú, àwọn ọmọ wọn ò ní dọ́mọ lọ́mọ lórúkọ Jésù. Gbogbo tí wọ́n bá dáwọ́lé á máa yọrí sí rere. Mo dúpẹ́ lọ́wọ́ àwọn doctors náà tí wọ́n ń lò fún wọn bí àwọn nurses wa, àwọn counselor, àwọn pharmacists, gbogbo wọn ni wọ́n ń tọ́jú àwọn ọmọ yẹn bẹ́ẹ̀ ni pé ọmọ wọn ni wọ́n. Olúwa máa bá mi ràn wọ́n lọ́wọ́. Then ọmọ tí mò ń mú wá síbí kò kí máa ń lo oògùn tẹ́lẹ̀tẹ́lẹ̀ tó wò wípé oògùn yẹn ti pọ̀. Tó nígbà tá máa dé bí báyìí, eléyìí tí wọ́n ń pò bí ẹ̀kọ́ òun la kọ́kọ́ fi bẹ̀rẹ̀. Nígbà tó yá kò gbà mọ́. But Ọlọ́run lò wọ́n. Ó lò wọ́n fún wa. Then program OTZ tí a tún wá, ó tún jẹ́ kó tún ní courage. Tẹ́lẹ̀tẹ́lẹ̀ kò kí máa ń sọ̀rọ̀, ó máa dá jókòó ni. Tó bá sọ wípé lọ bá wọn ọ̀rẹ́ ṣeré, a ní rárá. Ìgbà tí wọ́n darapọ̀ mọ́ OTZ club yìí jẹ́ kó ní àǹfààní àti lè sọ̀rọ̀. Ó ń bẹ̀ tí máa ń darapọ̀ mọ́ àwọn èèyàn tí mingle, ó ti interact pẹ̀lú àwọn èèyàn.
OTZ meeting has helped us a lot, because that guy sometimes doesn't want to take drug, but since he has been coming here, they talk about viral load, they talk about drug, so he has been cooperating with me. I give her the drug around 8 o'clock. Before 8 o'clock, she started disturbing me. Mommy, my drug is almost 8 o'clock. So, and I give it to her. And since then, I have been doing fine. Before, he will sick today, sick tomorrow. But now, he has not been sick again. So, she's fine. Then, our viral load is very fine. Less than 20 or not detected.
OTZ offers a package of care, including comprehensive youth-friendly HIV services, a treatment literacy package, counseling, peer-to-peer support, and mentorship. Facility support staff and OTZ champions, adolescent peers, motivate and support their fellow adolescents and youths living with HIV to become active stakeholders and partners in their health, encouraging them to achieve the targets of 0 missed appointments, 0 missed medications, and 0 viral load.
First got to this hospital before I started the OTZ program. I felt that this is a deadly disease, that it will kill me. I will go with it, I will giving up. But when I start going to the OTZ program, when I start meeting with my mates, they encouraged me, they told me not to give up, that I'm too young for that I still have a goal to pursue and a purpose, that I have not started anything at my age.
That has been one platform that has made me come closer to young adolescents who are like me, who are struggling like I was struggling years back, you know, with self-pity and everything. We come together, we talk, we get to hear from our doctors, you know, we get to hear health tips and other nice activities that is being packaged for us in the OTZ meetings.
Now I have confidence on my son, because before OTZ, I can't send him to anywhere without me going with him. But now I can send him to spend a week, 2 weeks with my brothers. I don't have any fear, because he knows the time to take his drug.
The OTZ program has been very successful and has led to an increase in the number of adolescents and young people who are comfortable disclosing their status and who successfully enroll in and continue on antiretroviral therapy, ART, till they become virally suppressed.